the London Autism Group charity. We are doing weekly live streams every Friday night on the topic of mental health and well-being during the COVID-19 crisis for the autistic and wider autism community. So every week we've been talking to special guests, but today it's just James and I. And James, you're a special guest anyway. So how are you doing, James?
Yeah, I'm all right, thank you. You're right.
Good. Yeah. Good. Not too bad. Coping. I mean, I was thinking perhaps we can start there with how we're getting on. How's the journey been? Let's say for us. Obviously, when in slightly different circumstances, aren't we?
Yeah.
Because with me, I live with my wife and my 3 kids and my dog and 2 of my kids. So I've got I better get this right, or my wife will kill me, right? But I've got a 4-year-old, a 7-year-old, and a 10-year-old, and it's the 4 and 10-year-old boys who are autistic. And I do have some experiences to talk through with regard to my perceptions of how they've, experienced things and, how it's impacted upon them, and also upon us as a family. Whereas with you, you're in a little bit of a different situation, aren't you, James?
Yep. I've been a single parent since Daryl was a baby, and he's now 12. So it's very different because Daryl can't communicate verbally. So we sort of made our own methods of communication, and we have to sort of struggle against his learning disabilities and things like that.
So he's got quite severe epilepsy, doesn't he?
Yeah. So we've been struggling with that for a few years. So and it's linked to the temperature, the body temperature. So we've even been quite isolated even before this coronavirus situation, because we can't go out and it's too hot.
That was something I was going to highlight, actually, as part of the differences, because I mean, you and I talk quite often, and one of the things that's quite evident from what you tell me is that you and your son, you're quite used to the sort of social isolation way of life anyway, aren't you? You're used to social distancing in many respects because of your circumstances. It's difficult, to risk your son, having an epileptic episode.
Yeah, but I've had a lot of time for the reflection as well, and looking back over the years, say there's been periods when I haven't had a partner and things like that. So my early life was quite isolated apart from family anyway, and that's to do with autism and not knowing about autism and the sort of social struggles when I was a teenager and stuff. So it puts everything in perspective and gives you time to think, at least.
And that's something that's come out from some of the interviews that we've done, isn't it? It's one of the themes that's come out from the interviews, and just seeing it on social media quite a lot, that obviously the autistic community and wider autism community are very varied. You can't just put everybody in one big box. There is variation, but one of the main themes or patterns, you might say, that comes out of just looking what people are talking about online and through our live streams is this issue of well, actually, this isn't that dissimilar from everyday normal life.
Yeah, so some people are enjoying it because it's, for instance, families, their children are having, once they've got over the shock of the routine of not going to school, breaking that routine, they're actually thriving away from the stress of being in the situation of being at school. So that's like quite a common theme. Or
Yeah, we've seen that in
um,
the group that we run,
yeah,
isn't it? So
or
we run the London Autism group, which is a Facebook
yeah,
group, and that has been something that has repeatedly been posted. That actually many people are almost in their comfort zone in this sort of environment, in this sort of climate. And a lot of the sensory issues, a lot of the sort of social struggles and uncertainty of everyday life is suddenly null and void, and it's all controllable to some degree
yeah.
within your home. So with the predictability and the control and the sort of you know the sort of comfort that comes with everyday life, I suppose.
With family members instead of maybe teachers that don't
Right.
know enough about autism, that aren't trained enough.
It's a good point actually, because I mean, so much of the stress and anxiety comes from, you know, professionals, you know, doing or saying the wrong things, not getting the right support, all the kind of stigma that you get from all of those kinds of bodies, right? Whether it's school or you know, supposed professional
Well,
state
it's not.
services.
I'm not talking about special schools. I think they've
Yeah.
mostly got some very good training and things like that. But autistic kids that are in and teenagers that are in mainstreams and things like that. That's where we get a lot of questions on the Facebook group, and I get people approaching me on social media with problems and things like that to do with that. That it's really the mainstreams that don't really invest
Yeah.
in the training, and
Yeah.
or maybe they've got the class teacher knows about stuff, but as soon as the children go to other lessons where there's a teacher that doesn't know, you know, so they can become very anxious about going to that particular class or something like that. You know, have meltdowns in one particular class, and that can impact on them learning in a particular subject.
Mm.
You know,
Yeah, yeah, and then they bring that anxiety home, and then
mm,
that kind of uh, interacts with the family, and
yeah,
more anxiety. So all of those kinds of issues, right, are to some to some extent null and voided. Before we move further with our chat, Mashiko Samia has just said, I don't know if you can see that, James.
yeah.
Yeah, she's saying hello, hello, Mashiko.
No.
Um, she's saying, okay, so James, do you want to comment on that? Because it's not you, you're not unwell, are you? As far as I know.
Yeah, I'm not unwell, but my son, he just has his epilepsy is sort of a permanent condition at the moment until we can get some medication that works. So I'm trying different medications, but it takes so long. It's a very long process because you have to build up the dosage very slowly and then see if it works. But all that's being done can be done. You know, it can be done is being done. So
Yeah, yeah. No, but certainly there's something that's come out from this is, as we were saying, that actually there's a good amount of people who feel more comfortable, or perhaps, or maybe just experiencing less anxiety than they ordinarily would because of
yeah,
all of the issues we're talking about.
and there's another issue that's come up with some of the autistic advocates. They've been saying maybe it's a good thing that non-autistic, that neurotypical people have been able to see what autistic people are going through, you
Yeah.
know, and see just a taste, have a taste of the situation, you know, of what isolation feels like, about, you know, what all
Um,
these things feel like.
Actually, in line with that, I hope Sarah. So, okay, so our so for listeners that aren't aware, we as I said, we run the London Autism Group, and we have an amazing admin um, uh, a member who's called Sarah Lawler, and I hope she doesn't mind me saying, but I saw an amazing poem that she wrote on her
Right.
website just about this. And I
Yeah.
wonder if she wouldn't mind. I should have asked her permission, but I suppose it's public, isn't it?
Mm,
But she wrote a really nice poem about this. Maybe I
mm.
should read it out. I think her
All right.
blog is Affinity with an A, isn't it?
Yeah. Yeah, it's a very good blog.
All right, let's see if I can find it on.
Come sit down, Daryl. Come on. Come sit down.
Sure, I can never find it when I Google it though. So, there's- oh, okay, maybe if I go through her Twitter site, but it's absolutely. Oh, here it is. Okay, so it's absolutely in line. So I wonder if she wouldn't mind. I hope she doesn't mind if I read it out because I saw it and I just thought, wow, it's so beautifully said, and
Mm.
it captures exactly what we're saying. So here it is. Okay, I'm going to read it out. Do you think she'll mind?
No, I think she'll probably like it that we read it.
Okay, all right, I'll read it out. Okay, the poem is called Autism Understanding in Uncertain Times. But by the way, before I start, you can find it if you go to an affinity with a .blogspot.com. Maybe I'll put the link in the comments.
Yeah.
And if you go to the blogs page, you'll find it. Okay, so the poem is as follows. Scared, anxious about things beyond your control, unsettled by change, worried by uncertainty, challenged by needing to communicate differently, upset by rule breakers, struggling to comply with new rules suddenly imposed, concerned about people getting too close, annoying others by getting too close, difficulty interpreting others' intentions. Will they go left or will they go right? Resenting enforced isolation, irritated by your environment, craving friendship and human contact, overwhelmed by information, solutions, and struggles, protecting with unsubtle accessories, creating structure and routine to feel safe, reaching out for things that bring comfort and joy, unusually absorbed by hobbies and interests, losing it, frightened for loved ones, knowing some won't make it, exhausted from being in a world different to your natural state of being. Well, welcome to our autistic world. We hope your visit leaves a lasting impression. Remember us when you're gone and don't be a stranger. Stay safe. It's just, isn't that such a good,
Mm. Yeah.
it really
Yeah.
captures it, doesn't it? I mean, all of the things there that she's listed is what people are now, getting a taste of. And I think that is one of the main points that we should really be emphasizing, really, that for a lot of people, this is a normality. And, it's an opportunity, as Kieran was saying in his interview,
Mm.
that actually going forwards, perhaps, the world now has a better insight and can therefore be perhaps more understanding and empathetic to, some of the struggles and challenges that a lot of people face and perhaps make this world a bit more, um, you know, a bit more, appropriate and kinder and, right for people with, different neurological, mindsets and what sensory worlds,
Mm.
So
Absolutely.
yeah, I mean, Kieran was the one who emphasized that in his interview, and I really think that is absolutely true. Just got a couple of comments. So another one from Mashiko. The only problem my son struggles with is a lack of routine. But actually, when he goes to school once a week, it throws him a bit, I think. So what do you think of that, James?
Yeah, it can be. It depends on the age, but it can be hard even to learn about transitioning from weekend to weekdays. I don't know whether it's got any bearing on my son, but sometimes he struggles on Mondays, particularly with his epilepsy. Um,
So
it can,
presumably, she's saying that I'm guessing she's saying that he's going to school, right, as part of
yeah.
the fact that he's an EHCP child and he's got the right to go. I mean, hi Daryl, how's he doing? Is he alright?
Yeah.
Well, I suppose it's not surprising because the whole routine has changed, hasn't it, from what he would have from what the son would have been used to previously. If he's the type of child who, of course, it's going to depend on all sorts of different factors, but if he is the type of child that really sort of relies on the predictability and structure of routine, and then all of a sudden the routines have changed, because that's the thing, there are new routines to be found, right? But we just have to transition to them. But that transition can be quite anxiety provoking and difficult. I definitely think there are new routines to be found and to be made and to be lived, for sure. But we just have to find our way towards transitioning towards them, and that's a struggle, for sure. And sort of the security and normality, I suppose, of certain aspects of going to school in the way that he was going previously, and seeing people and seeing teachers and experiencing things in certain ways and certain structures, that even though it's the same school, that that all being changed is going to be anxiety. So Machine can say to you, keep an eye on your son's well-being, talk to him as much as you can, communicate to him as much as you can, use visuals, use whatever you think is going to help him with his anxiety and getting used to transitioning to the new routine. We've got another comment from Moira Sinclair. Oh wow, she's from Cape Town. Hello, wow. I think you are our first Cape Town visitor. Thank you so much for joining the podcast. So Moira says, I have a residential home for autistic and special needs children for young adults. Special needs children and young adults. We took the decision to remain open as an essential service to help keep the residents in their routine, as it would have upheavaled their very fragile souls as we cater for the low functioning and non-verbal individuals. The hardest part of the lockdown period is not having access to get out and do some exercises. Well, I think that's great, Maura, that you're putting their needs first. You're really thinking through about their mental health. Ultimately, more than anything, it's going to be about that, isn't it? It's going to be about obviously about their safety, their physical health and their safety, but in conjunction with that, their mental health and their emotional well-being. The fact that they're not able to get out and do their usual exercises and their usual routines is going to be very, very difficult and confusing for them. But it's great that you're trying your best, and you're supporting them as much as you can. I often think about how difficult it is for anyone actually who's living in a long-term residential home with a high level of support need, and reliant on the care and support that they receive in their residential setting, and the impact that this has had on them for all the various reasons. That's something that we haven't talked about too much, James, isn't it? That particular population, and that is actually one of the most vulnerable populations, actually, in terms of their care and their support and their their normal life and way of living is fully disrupted, and the anxiety that comes with it.
Yeah, I'm quite well versed in care homes and that kind of thing, because my mum is in one. But I also have a friend who's a social worker, so he's done a lot of work with younger autistic people, adults that are in care homes and things like that. So I know it from both sides. I know from the perspective of a relative of someone in care. I know that it's incredibly frustrating sometimes that there's shortages of staff and that kind of thing. But I know the pressures that are on the staff as well, because I know somebody who's in that kind of line of work. Um, so I kind of know it from both ends.
Moira, if you don't mind saying, if you're still listening, let us know how your staff are coping and how you are coping, because I think that, I mean, that's ultimately going to be one of the key factors towards how well your residents are doing, right? How well your children and young adults are doing. If the staff are feeling themselves very anxious, or they've had to take off time from work because, of the potential risk that they think that they may not be well, or for whatever other reason, then that's going to have a significant impact. And I wonder what your experience as someone who's running a home has been with regard to that, and perhaps any suggestions you might have as to how to maybe help the situation, because for sure, that whole those environments um, are really, really crucial support for those particular types of people, and they rely on that care. They're used to that care and support. So for them, it must be a particularly concerning and strange and confusing time. Uh, Visits from families and friends would have stopped or significantly reduced as well. Um, so again, I think more it would be about finding ways to support your staff to have that indirect effect, positive effect on your residents, and also finding new routines that people enjoy, new structures, and transitioning to it in a way
Yeah, like
that makes sense.
in my mum's care home, they've got Skype, so
Yeah,
we
utilizing
can,
technologies. Yeah,
so families can talk, over the technology instead of face to face, which does help.
yeah,
Just being able to talk at least.
yeah, yeah, and seeing them
Mm,
and hearing them.
mm.
But I mean, exercises. That's a tough one, isn't it? I mean, in the UK, people are now allowed to exercise several times a day. There's been an amendment to the law regarding that in terms of autistic people whose care plan um, says that they require that kind of that kind of support, that kind of activity for their health, and so that's available. So it's going to be tough for you if it isn't on your side. For us, it is. People can go out and have walks and do a little bit of exercise, as I said, and people with learning disabilities as well, and autistic people are now having that as an option. But if you don't have that option, that's really, really tough. So it would just be trying to be creative and innovative, find new ways of exercising, I suppose, and new routines.
Yeah, my son has been relying on his sensory equipment, like the big yoga ball that he's got that he can bounce on and just doing like physical kind, doing a lot of dancing and things like that.
Moira said a couple more things, and I see that we've got a couple of other comments. I'll come to them in a second, but I'll just carry on with Moira for the moment. She says, um, we're not considered as the most vulnerable in our country, so we've not received any aid, but we are still more forward defending their rights. Well, okay, well, it's quite a bit different to the UK. Obviously, the UK could be doing a lot more. They don't ever really put the disabled community in the forefront of their minds when they're designing policies and laws and that sort of thing. It's always a sort of afterthought often, uh, that type of thing. But at least they are recognised. Autistic kids, people with learning disabilities are recognised as vulnerable and do have the option to now go to school and get support from their usual their usual teachers and teaching assistants, I suppose, and just in a different way, given that everything's changed. So they are identified as vulnerable, and there is aid, and there's other levels of aid as well. And so, for example, vulnerable people over here have been frontline and first in queue for online deliveries. Not all people, because James, I know you haven't had that luxury, have you? You weren't contacted by your local supermarkets, but I know a lot of people on my side that have who have um, who are vulnerable themselves, or have an child or family member who's for that reason have been given the option to have online delivery for foods and supplies and things like that. So it's not always consistent, but it sounds like it's better than what you have over there, Moira. So I suppose it's just about fighting, push back on the policies. I was talking to, this might give you some hope, Moira. I was talking to someone yesterday, a lady called Dr. Rebecca Wood. We're doing some research together. She's a lecturer in special educational needs at the University of East London. And she was telling me um, that she was the one that really began pushing back and writing to the government about autistic people and people with learning disabilities needed to get out more than just once a day, and that their needs maybe haven't been fully appreciated in the original policy about getting out once a day. It's the only thing that was allowed initially. And she told me that was the easiest fight she ever had, because usually every fight when it comes to changing policies for special educational needs is like, a nightmare battle, right? But with her, it was apparently, she was saying that the fight probably is, they know the media is scrutinizing every move they're making. So it could be that if you push back and communicate with the government a little bit about that, you might get a little bit of success. Who knows? Threaten the media on them, and you never know. That always gets them to listen. Right, and so Moira has said, I started my NPO as there is nothing in South Africa like a care home here. There is some cracks in the superhero caregivers as fatigue settling in. Been a difficult time for both the carer and my kiddies, my son being one of them. FaceTime is the best. We can only exercise between 6 and 9 a.m. in the morning, which throws them off completely with their morning routine. What do you think, James?
Yeah. I think routine is very important, and I think even when we come out of this, it's going to be a struggle just to get back into a normal routine. So just hoping that it's not going on for too long. But it's also the uncertainty is also a thing that causes anxiety, isn't it?
But she's really saying what we were saying earlier, isn't it? That fatigue is settling in, it's been a difficult time for the carer, and as a result, the children. So, crikey, it is a tough one, that, isn't it? The fatigue is settling in. I think it's beginning to hit home here as well, the fatigue, in for a lot of people. It's been quite a number of days now, and people are beginning to burn out with it, really. So it's obviously it's going to be different for everyone, but for carers supporting children in residential or adults or older adults in residential settings, and who've got their usual everyday lives and family, as you were saying, you've got your own kids, and that and your son being one of the children you're supporting. All these people have got additional responsibilities. They're at risk of burnout, aren't they? So I suppose it's about thinking. I would recommend thinking about how might you boost their mental health and their well-being. I'm talking about, well, I was thinking about the carers, but also that will have an indirect effect, hopefully, on the children. Are there perhaps things that they would enjoy? They would really that would boost their morale. Some team building, boost their energy. It's got to be something. Maybe have a think about that, because ultimately morale and fatigue are going to be the key thing. But we wish you luck. And I had no idea that you didn't have um, care homes for people with learning disabilities or autistic people in South Africa. That's a shocker. I had no idea. Did you realise that, James? I thought that'd be a standard thing.
No, it just didn't occur to me.
Yeah.
So,
Well, I suppose we're quite lucky in many respects here, aren't we? We're quite we're quite ahead of the game with this sort of stuff, but we've got a huge way to go as well at the same time.
it's only really been in recent years, though.
Yeah.
You know, um, it's not that far back that
Yeah.
it was a similar situation.
And obviously we've had scandals as well in residential settings, like the Mendip House
But
scandal.
it does show that change can happen. Because it happened here, and it wasn't that long ago, so it can happen there as well. There's also maybe I should highlight some. I'll put some links on our charity page. I'll give you some links to put when we finish this live stream. There's some work that the British government support, work by the British Council, and there's also an organisation called Mates, which is MAITS, or there was. I haven't been involved uh, with them for a few years, but so they're both basically look at working internationally in situations like that, and the using the resources that we have to share information. And with Mates, I know that I can't remember which country, but it was an African country where in my son's uh, in my son's primary special school, they had like a teacher exchange where they hosted some teachers from an African country, and then they sent their special needs teachers out to help they were shown around the special school in that country, and then they helped with the training and that kind of thing. So that's the organization Mates. And I know the British Council also do work in that regard with like they'll have a situation where they'll be on, so using software like we're using now, where two classrooms will be able to, in different parts of the world, will be able to see each other and communicate and that kind of thing, and share experiences and that kind of thing. So I'll give you the links for all that later on, and we can put it on our charity page.
Yeah, yeah. The charity page being londonautismgroupcharity.org. So check that out afterwards. We'll put it on that. We'll put that and anything else that's relevant there as well. So thanks, Maria. Maria is saying that that's the phone number she's used to access Morrison's first sort of priority for vulnerable people when it comes to online deliveries. That was what I was mentioning before.
Oh, okay.
So that's really useful. So thank you for that. And yeah, Rame is saying that she didn't realise that. I do think it's not necessarily fully consistent, because I know, James, you didn't get contacted by anyone, but
The only
people were.
support I've had is from Daryl's school, which they have arranged for a voucher uh, every week that goes towards the shopping and that kind of thing, because he's in all the children are entitled to school meals. So that's instead of that entitlement, they get a small voucher towards the shopping. But that's the only thing.
Moira, I think we have to get in contact with you and maybe interview you, because if you were interested, because my goodness,
Yes,
if you're the first one to have done this in South Africa, to have opened up
that's a
a
good point.
residential home, you're really sort of breaking ground.
Mm.
You're a real sort of inspiration.
Well, maybe we can do something with the autism podcast.
Yes, Moira, have a listen to our podcast if you want. It would be great to perhaps interview you on it. Uh, the podcast we run is the Autism Podcast. Just that. Just search for that, the Autism Podcast, and you will see. We're about to interview actually someone from Africa, our first African podcast, based in Kenya. So that will probably be coming up. But yeah, it'd be great to hear the South African experience and story, perhaps. So we'll be in touch. Um, so any other comments that I missed? I posted the poem. Oh, Moira said, "No, I'm not. The kids are." You. I'm sure you are. I'm sure you are here. A hero. You are a hero for doing this. There's no doubt about that. It's really fantastic. Um, so, so as we were saying earlier, um, one of the main things that's come out of this is the sort of experience that people are now having in relation to actually what life can be like for a lot of autistic people and people with neurodiverse conditions, and experience sort of social isolation, social distancing, loneliness, right? And so, and of course, also the anxiety of everyday life as well. There's a lot. Obviously, the neurotypical general population now experiencing a lot of anxiety. It's been widely reported. A lot of stress, especially among the younger population who are coping less well with it.
Well, I think it's the bombardment of all the news, you know,
Yeah.
and because because people are, online. Okay, Darren.
He's agreeing with you there, 100%.
Yeah, because people have got access online all the time, so it can be quite toxic and quite easy to become fixated on the negative news.
Yeah, definitely. I'd say controlling your sort of your intake, you might say, of news
Yeah,
is going to be important for everybody's mental health, because it's a constant bombardment of negativity at the moment.
and if autistic people are on their own as well, I've seen they're very vulnerable to fake news. So if there's some kind of fake disaster story, they're likely to have a meltdown, and you know,
Yeah,
so
yeah, yeah,
so I've just told them to avoid it and do something else. You can schedule your day and find comfort in the things that you've always found comfort in, and do the hobbies that you've always done. And now's the time to. It's kind of the reverse of what a lot of sort of harmful therapies have been saying. Like now is the time to encourage kids to self-regulate. Autistic people in general to self-regulate. They um, you know the stereotypical thing of flapping their hands or whatever. whatever they do, all those behaviours they use to calm themselves down. Now is the time to kind of encourage those, because we need them, you know.
Yeah, yeah. Moira has added another comment. She's got a link here of short 4-minute video of Ryan getting through his daily life challenges. Just an example of what all of our residents go through daily. Please feel free to share. All right, we'll certainly share that on our various places, and it's here now as well on the comments of this particular stream. So thanks for sharing that. One thing I wanted to talk about was a couple of other things I wanted to talk about. Well, firstly, perhaps I'll just briefly explain how it's impacted upon us and our experience. Let me just add that title. There you go. So for us, it's quite different, actually. We have been impacted in a couple of different ways. So my youngest son, the 4-year-old, he was diagnosed quite early, and it was quite clear to us that he was on the spectrum, and he wasn't necessarily meeting the standard milestones, and his speaking language was really significantly delayed compared to neurotypical kids. And he was clearly socially interacting and socially communicating a markedly different way, and sensory issues were quite obvious. So for him, his main struggle has always been speech and language, just managing his sensory world, and just the reduction of anxiety through social interaction that works between him and us. Do you know what I mean? Because he'll get a lot of anxiety when his attempts at social interaction don't work very well. Do you know what I mean? Not because of necessarily his fault, but because we're not necessarily fully in tune. So he gets anxiety and frustration, and I always feel terrible when I don't understand what he's saying or what he's trying to communicate. I mean, I've gotten better with it over time, but he's been having a lot of really good professional support. We've been very lucky with the experts and professionals that we've brought into our home, who've been just playing with him, interacting with him, really sort of getting into his world, sharing it, reducing anxiety, and that then having the knock-on benefit of practicing more and more social interaction. And with that comes better language and speech and language, and sort of really he was making significant progress, I would say, over the last year, in terms of all of these areas. And I've undoubtedly seen a somewhat of a slowdown, or you might even say a somewhat regression. I'm not sure if regression is the right word, but do you know what I mean? It's a markedly slower downturn in that transition, and that's been quite tough, because he still is doing great. He's happy boy and everything, no problems, but you can see that some of the work has been somewhat undone, in part because he loved it. He was really enjoying seeing certain people at certain times and doing these sessions in certain ways. For him, it become a new normal and routine, and the loss of that coupled with the change in everything that's happened, has really, I think, increased his anxiety and confusion. I mean, the other day we've been obviously doing our usual daily walks with the family, and the other day it was the first time he really sort of said to us, or he indicated to us, that he wanted to go to the playground, because he loves this particular playground. And we sort of purposely trying to avoid avoid that playground, so it didn't sort of trigger his memory into wanting to go in. they're out of bounds. They're not allowed. You can't go in there. What can you do? That was the first time where he was, oh, playground, playground, and then direct his attention elsewhere and try and steer it away. But you could see his anxiety and confusion definitely went up. And then when we got home and he remembered, you could see it on his face, James. He was just so upset and confused at the same time. Why wouldn't we allow him to go? The playground was empty, and it's a real shame. And then, of course, his well-being and happiness is our number one priority. So we're then sort of just thinking and focused on, okay, what else can we do to make him happy? And we try our best, but at the same time, it's always going to be confusing for him, isn't it? So for him, that's been our experience. The sort of the impact of the professional support we were getting being removed, and the anxiety that's increased as a consequence of that, and some of the confusion as well. You can see it's been a bit of a struggle.
Have you been in touch with the professionals?
Yeah.
Maybe they can suggest some things.
Yeah. We have. So we've tried doing online sessions times, and that's definitely been good and helped. And we're doing a lot more visuals with him. So we've definitely done some things. So some things are okay. It's just overall, it's not quite as impactful as what it was previously. And also, one of the professionals we had was ill for a couple of weeks. It may have been Corona, a few weeks, and so she wasn't even available. So, regardless of Corona, I suppose no, it may have been Corona, so it would have happened because of that. But so we were sort of doubly unlucky that she wasn't even around. But anyway, that's been the problem. That's been the issue with him. And then with my 10-year-old, my 10-year-old he loves. He doesn't particularly like being indoors. He's one of these kids that likes going out and doing certain things, ticking certain boxes in his mind, experiencing things in certain ways that, work for him and reduce his anxiety. He really sort of relies on the normality of everyday routine. He's one of these kids. And he has these specific things that he had in mind that he was going to do in April. One of them being, we had a plan to go away to Seattle, where my wife's family lives. And he had it all built up in his mind, all the steps, and he was so excited. He just loves Seattle, and he loves doing certain things on the journey to Seattle as well. It centers him. It clearly regulates him 100%. And him having to process and deal with that loss has been profound for him. It's been really, really tough. So he's had a number of bumps in the road in terms of his mental well-being and how he's coped with all of the changes. For sure, it's been tough. He's done really well overall. He's coped well, but it has been challenging. So that's been our experience, and then we also, as parents, we're also affected by it because we feel terrible for them. We want to make them as happy as we can all the time, but can't always. And we haven't got solutions. Can't just go to Seattle. What can you do? So it's been tough for us in that way, but overall, it's not been too bad. I mean, we've been lucky, but that's how it's affected us. I would say so far. So it's different. It's a different sort of story, isn't it?
Yeah.
So one other thing, there was two other things I was going to talk about. Well, let's start with the frailty one. So I just wanted to just talk a little bit about this because I do think it's super, super important and very telling that this happened. We've mentioned it a couple of times before in the live streams because it happened a while ago at the outset of the pandemic. Well, not at the outset, but
there's been some repercussions from that, hasn't there?
Yeah, there's been some. So let's give some context then, shall we? So obviously the epidemic taking off in the UK, and obviously there are limited resources within the NHS for treating and treating and caring people with severe complications as a result of coronavirus needing hospitalization. One of those resources that they rely upon and didn't have at the beginning very much of were ventilators, right? And as part of that, the NICE, who is the National Institute of Clinical Excellence, who come up with all of the recommended um, uh, 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 health guidance that clinicians should be following. In fact, by law, because they're a government body, aren't they? NICE. They suggested that, or didn't suggest, but they stated that the way that people should be prioritized in terms of who gets a ventilator and who doesn't should be based on frailty, right? So if you are an older, frail person with lots of comorbid illnesses beyond just coronavirus, you've come in with coronavirus, but you've got all these additional illnesses, you're very frail, you haven't necessarily got the longest life ahead of you in terms of just what, when you just look at the whole picture. Those people should be deprioritized if there is a need to instead treat a younger person with less frailty. So if there's one ventilator, two people, one's elderly, frail, another one is younger and healthy, you give the ventilator to the younger one because they've got less frailty. That's the basic premise. But particularly, I mean, that's controversial enough. The particularly controversial bit was that NICE originally recommended that people with learning disabilities, regardless of anything else, should be scored higher on the frailty scale compared to people without learning disability. And therefore, as a consequence, people with learning disabilities all of a sudden are more at risk of not being treated compared to someone else who's identical to them but without a learning disability. In all other regards, same health status, same level of frailty, no learning disability. Obviously, a lot of autistic people have learning disabilities, so this is going to directly affect the autistic community as well. I mean, that is just shameful, I think. I mean, that isn't just controversial, that is absolutely shameful that they ever suggested that, and even put it into law and practice, because that's got nothing to do with frailty. I mean, whether or not you agree with the whole frailty approach to allocating resources, there's another story. But the idea that you conflate learning disabilities with frailty, what planet are these people living in? What do you think, James?
Yeah, I think we've seen it before with a few years ago where there were many hundreds of deaths that went uninvestigated in southern England under Southern Care, the healthcare authority, and they basically thought that was okay to kind of dehumanize people with learning disabilities, and they let over 1,000 deaths go uninvestigated. There was a whole inquiry into that, and it was only brought about by all of the parents of these people getting together to fight it, and bringing it to court. But so we've seen that before, and this is just another instance of that. Really, it's shocking that people in these positions are actually advocating, this kind of thing. People that are making the decisions over these care bodies and that kind of thing. What also followed after that was also equally shocking, was the very callous statements made by GPs, many GPs over the whole country to not only to regarding autistic people or people with learning disabilities, but also to carers that might have elderly relatives and things like that. That any of these people, they said there was no bones about it that they wouldn't receive any hospital care, that you know they couldn't even, not even to send them to hospital,
Yeah,
to save NHS resources, and the way people were spoken to was just horrendous, spoken down to. It's like the professionals were taking out all their frustrations on these families and of the most vulnerable, which is completely wrong.
yeah, yeah. No, you're right. What happened was GP practices were sending letters, weren't they, to people with learning disabilities and their families, saying that they were unlikely to be prioritised for hospital care because they would be viewed as as less important, and
Yeah.
you know how I mean, as if you aren't already confused and scared enough, you get a letter like that saying, "Well, you're going to be assessed as low priority for a ventilator and treatment just because you've got a learning disability." I mean, honestly, you'd think that GPs would have better sense to question. I mean, that's the wider issue, isn't it? You've got a bad policy, right? You've got a bad recommended policy by NICE. Yeah, fair enough. NICE, changed it, as quickly. I mean, I'm not sure quickly is the right word, but they changed it, right? After they got pushback from communities, which was obviously always going to happen. Um, uh, 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 but I mean, it was there. That policy was there. That was recommended. Now, okay, it's a policy, but still, if you're a GP, if you're a professional, you still surely you're able to think critically about things. Shouldn't doesn't it point to the wider issue that these people aren't thinking critically? I mean, surely can't just blindly follow the most.
Well, that's the question, isn't it? It brings up the question of why so many weren't thinking like that, and is this what they really think, and does it impact on this issue of them having mandatory training for autism and neurodiversity generally? And I think it does. I think it brings, it brings out the sad truth that there's a long way to go, before we reach like a proper understanding from health professionals and that kind of thing.
Yeah, yeah. I wonder whether they're maybe also, as a group, perhaps scared to question it. In case they suffer, repercussions, lose their license, or whatever it is. Because how can you not question something like that? I mean, it's obvious. Don't we all know the basics of what frailty is? I mean, it's not a totally foreign word, is it? So if somebody says to me, "Oh, you have learning disability, so automatically you're more frail than not," then I know that that's highly unlikely. That's highly questionable. But anyway, it has been since rectified, but that some damage was done, some significant damage was done, and it is very likely that in some cases, unfortunately, where ventilators were in short supply, people with learning disabilities were deprioritized before the message got through to them that they shouldn't be scoring them lower on the frailty scale. So significant damage was likely done. But as you said, I totally agree. It just clearly, spells the need yet again for professionals to have much better understanding and more effective training, because they probably do get some sort of level of training, but it's probably rubbish.
It needs
Probably
like firm guidelines as well, so that the ones that don't, that will sort of never, they'll never sort of go along with that. They need to, it needs to sort of be enshrined so that they have to go along with it, you know.
Yeah, yeah. Um, so yeah, I mean, the only other thing I wanted to talk about was about homeschooling. Just again to point out the fact that something else that's come up from our live stream is how a lot of people are struggling with homeschooling, but again for a lot of autistic kids or kids with other neurodiverse conditions like ADHD and whatnot. Um, this is again a normal thing, isn't it? Homeschooling,
Mm.
and all of a sudden it's now being viewed as normal and okay and to some degree acceptable and doable. But previously, it was viewed as it was kind of stigmatized, wasn't it? Frowned upon.
But it wasn't against the law. You had the right to do it,
Yeah,
but it wasn't advised, and people would try and talk you out of it.
yeah.
But there were a number of parents doing it for various reasons.
I mean, I just hope that one of the lessons that comes out from this, one of the opportunities, is that more parents going forwards perhaps consider homeschooling as opposed to traditional schooling
Mm.
if it is in the better interest of their child. Because it could be that the homeschooling, that it could be in some instances that actually now having homeschooled, their child is feeling less anxious, less stressed, and they're feeling more confident than previous about
Mm.
being, as a parent, being able to speak confidence. Um, and so going forward, the I hope society, gives people more leeway when it comes to, supporting them and accepting that this is a good viable option for reducing anxiety and stress and the reduction of wider mental health problems. Uh, you know, than sending them to school where you often get a lot of problems. Um, so I hope that's one of the things that comes from this. That actually is a recognition. Actually, it's okay. This it can be done, and we've seen the benefit in many cases. Obviously, there's a lot of variation. You've got to find what works for what child, but I'd like to see it more normalized, perhaps going forwards. Personally,
And if a parent wants to do it, then there's no reason, you know. And if it does benefit a child, then there's no reason not to. You know,
yeah,
just don't just for the sake of it think the child's better off at school because by perhaps keeping them at home, you're taking off of their shoulders a lot of the stress associated with school, whether it's um, it could be the stress of who's teaching them. It could be the stress of their peers that don't understand them and don't appreciate them. Could be the environment that they're in that doesn't meet their sensory needs. It could be all of these things, um, and just the kind of the relief that must be to be out of that situation for some people must be immense, and that would be a positive benefit for their mental health, and therefore they're better able to learn at home.
yeah, exactly right. Obviously, homeschooling. Let's be careful with what we say. What in terms of what homeschooling means, because we don't want to perpetuate the idea that it's just about sitting at home all day. Because homeschooling, actually, to my understanding, it does involve quite a lot of going out
Yeah,
and visiting
definitely,
museums and yeah
definitely.
and
There's
whatnot.
a whole range of things outside the home, and
Yeah,
there are even organisations that set up for, it's almost like a one-off lesson that children could go into a place for a one-off lesson. say they've got a special interest or something like that, and the parent is taking them out to these places, and doing the homeschooling for 4 days a week. 1 day a week, they might go into somewhere that is equipped to handle, you know, all their needs, and they can do a special interest.
Yeah,
I've heard of that kind of thing, and
yeah,
it's been sort of very beneficial to
yeah,
some people that have been homeschooled.
yeah. So I think the main thing for me is that it's just not as stigmatized as it was before. Do you know what I mean? That is the main thing, because it can be done. We've got clearly got technologies and the capacity to do it. Every child is different. Every child has got different needs, and there's no need that's more important than any other, right? It's just different. So, it shouldn't be that some solution to some need is stigmatized over some other solution to some other need. Um, so, yeah, I mean, those are sorts of things that I wanted to talk through. It's been fun chatting, James. Been really good as usual. Any sort of other things that you wanted to talk about or recommend or highlight?
Well, just I think from what I'm hearing from people, that they are sort of getting used to the situation now. A lot of people that I've been in contact with. Um, so there's just use your coping strategies, and that work, you know, and
Yeah,
don't succumb to the kind of the toxic uh, bombardment of news. This it's not going to be all doom and gloom, because we need to sort of focus on just one day at a time. That's what I do,
yeah, it's good
and
advice.
before you know it, we'll be back to a better, better situation.
Yeah, yeah. I mean, one thing we haven't talked about is the likelihood that everybody knows someone directly or indirectly that's been affected by corona. Whether it's, one step removed or two steps removed, someone close-ish you'll know, and sometimes it could be really close to home as well. So we should sort of recognize that that's really tough, isn't it? The stress that comes with knowing someone that is unwell and or has even tragically, unfortunately, passed. So there's a lot to sort of process and deal with. So I think what you're saying about taking it day by day, being kind to yourself, not being too negative to yourself about how you're handling things. Try to find new routines, as we said. Find things that make you happy and calm you, and regulate you, and center you. My camera is flickering around a little bit, isn't it? Sorry about that. But yeah, if you can find things, obviously it isn't impossible to find things that center you. One thing that my wife and I have found, funnily enough, that we never ever considered before, and it's been actually really good for our mental health, is just playing jigsaw puzzles.
Yeah,
So
yeah.
we'd never ever played jigsaw puzzles before.
That's a really good thing for couples to do. My
Yeah.
parents always did that. No matter how much they might, whatever sort of arguments there were or whatever over the years, they always came together over jigsaw puzzles. Yeah. And that was a big part of it was before the internet and things like that. But
Yeah. I've seen on social media the sort of resurgence of jigsaw puzzles. It isn't just us. There's sort of a demand for it, because it's just a nice little thing to sort of focus your mind on, and
it's a really good collaborative,
yeah,
thing that you can do.
yeah,
Yeah.
yeah, and you really feel victorious together when you get it after weeks or days. Well, we had one puzzle that literally took us weeks, to complete. It was
Yeah,
so
yeah. Can
hard.
be thousands of pieces. Yeah.
Yeah. So that's what I'm saying. For us, I don't know how we found it, but doing a jigsaw puzzle and just sort of whatever time we have in the day after
Yeah.
the kids have gone down,
Yeah. Just share something. Yeah.
yeah, has worked really well. So if you can find something that works for you as well, and I promise you, one thing I'm sure of is not impossible to find things that will, you know, be good for your mental health. I mean, jigsaw puzzle 100% has been good for our mental health. Um, if you can find something, whatever it is, you know, do that because you're going to need it in this challenging time. And if you can help others, do so. Um, it's nice to look out for your elderly or vulnerable neighbours if you've got any around you. I've been doing that on our road. Got a couple of elderly people near us that we're keeping an eye on, and that's good for mental health for yourself in a selfish way, isn't it? As who was saying that? Was it Kieran that was saying that no altruistic act is truly altruistic because a lot
Well,
of
I
it.
believe in that as well. I do. Yeah,
Yeah.
because
So
it comes back. Every good thing you do does come back, and you feel good about yourself. You know, so it's good for everyone. It's good for everyone's mental health.
yeah, so do that and help your community if you can. Uh, so we've got one final comment here from Moira, well, unless any others come in the last couple of minutes. I was born in the UK but came to South Africa when I was young. Count yourselves blessed. You are honestly leaps years ahead of us. Well done, guys. Brilliant platform to chat and get ideas from. Well, thank you very much, Moira. Have a look if you're interested at our YouTube channel or our Facebook public page, the London Autism Group Facebook page. If you just go to Facebook and search for London Autism Group Charity, you'll find it, and you'll see all of the previous recordings of our live streams that we've done. We've had some really fantastic ones with amazing people. Last week we spoke with Catherine Pons from Thrive with Catherine, who's an ADHD expert and neurodiversity expert and mental health expert. She was giving great advice. Kieran Rose, who doesn't need any introduction, one of the most famous and well-known and incredible autistic advocates there are. We spoke with Robert White, the autistic comedian, who's just the best and nicest guy you'll ever meet. We had a great one with Lola Alvarez Romano. It was the first one where she talked to Lola is an NHS psychotherapist, so she really, and it was at the outset when this was really sort of taking off initially, and people really had high anxiety because they were getting used to this transitioning into this new normal. And Lola gave some amazing advice as to how to look after your mental health for the autistic community, and more. So please do. Teela Pritchard, PDA expert. We had him last week. That wasn't last week. That was the week before, wasn't it? And then next week we've got an interview with Georgia Pavlopoulou, who's been on the podcast before. And she's an expert in sleeping issues in the autistic community and mental health and how that interconnects with sleep, and also sibling well-being. She's an expert in that domain, including other bits and pieces. She does a lot of research with the autistic community. She's really fantastic. She's a well-known advocate and researcher at UCL, University College London. And she's going to be on next week, perhaps with a colleague or two of hers as well, so it'll be fun. So come along every Friday night, 8:30 p.m. UK time, and chat away, talk, and we'll always pick up your comments. And that's it. This is just something that we think could help the community. If it helps one or two people, then that makes us happy. Okay, that's it from me, I think. Anything else from you, James?
Yeah, no, that's fine. I think been a good session. Yeah.
74 minutes it says on the timer. Already gone away. I don't know where it went, but it went. Incredible.
Time does go. Yeah.
Yeah. All right. Well, thanks for the chat. Take care, Daryl.
I think he's ready for sleep now.
He's ready to sleep. All right. I'll let you guys go. All right. Well, thanks very much. Take care. Speak to you soon.
Thank you.